this episode of Africa Health Check.
When we came to know about COVID, we had to take the advice of the doctors, of the nurses, of the health workers.
Those people employed by the government, the chiefs and the sub-chiefs, should be able to be in front line.
We explore the significance of strengthening primary healthcare systems in Africa.
We need to be strong advocates. Advocacy at all levels, both at the primary level, at the secondary level, and at the tertiary level.
And the potential strategies required to achieve universal access to healthcare on the continent. Primary healthcare, or PHC, serves as the foundation for building a robust healthcare system that caters to the health needs of all individuals across Africa. In Africa, the COVID-19 pandemic highlighted the weaknesses in PHC systems, calling for urgent and sustainable reforms. On today's episode, we will be discussing strengthening PHC and overcoming barriers. I am your host, Tlejang Paladi Morokozo, and I welcome you to Africa Health Check. I am joined by our experts, Dr. Marianne Mureithi, the chair in the Department of Medical Microbiology and Immunology, and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. Before we get to hear from our experts, let us have a look at this episode feature story.
I started off as a banker, spent a couple of years in banking, and then I verged into the non-for-profits. At the moment, I work with Smile Train as the Vice President and the Regional Director of Africa. I joined Smile Train in 2011, and I've grown through the program now for more than 12 years. Primary health care is the first point of health care in any health system. And in Africa, we have made steady progress. We're not there yet. But at the moment, there's been a lot of challenges, especially coupled with the COVID pandemic that we all experienced and had a big bite on the fragile health system Africa already had. Health systems are not just built on brick and mortar, not just the building. So you look at equipment, you look at the skill sets. When I mean skill set, I'm talking about the manpower, the workforce, the medical workforce that would take care of the sick population. We also look at the records, the medical records, and this is where research comes in, data comes in to help, make an informed decision based on evidence. You also look at the vaccines, the medications. You look at the governance, the leadership. Who are the people that are the leaders, the medical leaders in Africa today? So we don't need to fly in any doctor to treat children or adults born with cleft. In any part of the world that Smile Train has a program. We train, we empower, we equip, we resource the medical professionals, the hospitals, the facilities, so that they are able to provide 100% safe and high quality surgery and comprehensive cleft care to anybody who walks in or who is in that community that requires that service. And that is one of those achievements for children or any person born with a congenital malformation. And then from the data and the information generated, the government will be able to use those evidence to formulate policies that will drive development in the health sector. Africa's history has been written by others. The time has come now for Africa to own their problems and solutions and write their own stories. This is a very popular quote by no other but President Paul Kagame of Rwanda. And I would say that we really do love the idea that we have HICs collaborating and supporting Africa. But most importantly, we want this support to be genuinely of impact. In only that case would it be meaningful.
Thank you for joining us today, and we're going to dive right into it. And I want to start with Dr. Marianne. Let us use this opportunity to sort of lay the foundation and also empower a viewer at home about what is primary health care.
Thank you, Gigi. Great to be here again to discuss this very important topic, primary health care, which for me, I always say it's the alphabet of medicine. You know, this is the basic building block where we start. What is that essential service that we provide to people when they're not feeling well? And that service should be something right close to your doorstep. You don't have to travel miles for it. Yes. And this service should address your health problem, should address your nutritional needs, should address preventative needs as well, such as vaccines and other preventative measures, and should address any other challenges that may affect your health, because we want to make sure we have healthy communities, your well-being being at the top priority of what primary healthcare is. So these are the essential services that will bring to you right at your doorstep or very close to you, so that your well-being is addressed and is good.
Absolutely agree with you. And maybe just to bring you in there, Reverend, you could just outline some of the key weaknesses in the delivery of primary health care in Africa generally.
Well, I'll mention up 2 or 3. Number one, you talk about the healthcare workers, you talk about the workforce. If you have a lot of untrained people in the field, then how do you deliver the service to the people? So one of the challenges of PHC in Africa, in my country, is inadequate workforce, healthcare servicemen. The other challenge will be funding, because it's capital intensive. Treating sicknesses, prevention, health literacy, all of them involve money. And in Africa, you know, among many, many challenges, it always falls short in that. The other challenge will also be infrastructure. You know, inadequate infrastructure, few infrastructure, not properly furnished infrastructure. The doctors are there, but the equipment to use to deliver the service are not there. These are but some few examples of the challenges that we face, the PHC in Africa.
Yes, and they cut across, and I'm sure that many people, wherever you may be listening from, can definitely identify with that. One of the key stakeholders in the delivery of primary health care is the public practitioner, and I want you, Dr. Marianne, to sort of just highlight some of the key responsibilities and obligations a practitioner, because you are a medical practitioner, has towards, or the role that they have to play towards a successful delivery of PHC.
Yes, so as Reverend has highlighted some of the weaknesses in delivery of primary health care, I would also want to highlight one of the pillars is mentioned, and that's what you've asked, the healthcare provider, the practitioner. Yes. What do they need to have? What do they need to be equipped with? And what is their role? First of all, they're trained, and some of them have even taken an oath, swearing that they will always put their patient first. But, for example, if they do not have the adequate infrastructure, the adequate education, the adequate funds to be able to have the
capacity,
the capacity. The supply chain is broken in that, for example, in Kenya, my practitioner somewhere in the forest or in Turkana in the dry area has to wait for days to get the vaccine coming from the warehouse here in Nairobi. In Kenya, for example, you get bitten by a snake somewhere in Baringo where we have a lot of snake bites. They have to make a call to Nairobi. And then from Nairobi, they have to make a call to South Africa and get the antivenom. There's a gap. And so I'm trying to imagine this healthcare practitioner who's treating that snake bite, the frustration they would have. They're equipped, they know, they can identify, they are there with the patient, but their hands are tied. So apart from having that knowledge, having the equipment, the capacity, they should also have an enabling environment so that they can give the best to their society. Another thing a practitioner needs is to have a very good team support. Team support meaning that if this is a medical doctor, they should have nurses, because nurses have an extra training to care, to offer that loving care to that patient. They should be community workers who are then going to other members of that community, educating them
and the volunteers.
That we can have preventative measures. So they're treating, but there's many other things going on in the background. There should be a pharmacist there, Reverend, who is also prescribing. You know, there's something we're talking about right now, which is called antimicrobial resistance. That's the silent pandemic. That's what we're calling it, because it's a pandemic that is being fueled by either lack of proper medication or abuse of these drugs. So we need, for that practitioner, we also need that team of people who are prescribing the correct drug at the correct time, because we're also trying to prevent this other silent pandemic that has been slowly burning, and we're not talking about it enough. So there's so much this practitioner needs, but I think the biggest need is to have that team effort, team support, and a community that supports them so that they can also deliver their services. And that is the primary health care.
Yes, that's well put. A lot of the challenges that you are talking about are challenges that have existed even before COVID-19, you know, and we know that a lot of countries have made some positive strides in investing in their healthcare system to make it more resilient, more sustainable, more transformative. However, they've also taken a big hit because of the COVID-19 pandemic. So maybe you could highlight some of the biggest effects that COVID-19 has had on the delivery of PHC.
Yes, so again, I'm a teacher. So when I look at things, I look at them in two ways. COVID-19 was a blessing and also a curse to primary health care. A blessing because it really exposed some of the underbellies, some of the weaknesses in the system, and we were able to fill in those gaps very quickly in terms of providing for our healthcare practitioners, in terms of PPE, in terms of vaccines, in terms of clear messages to the communities on how to prevent disease, how to treat diseases, and how to keep them away. Another thing that COVID really brought out was the provision of services we never really thought of. Oxygen. Oxygen never kept me awake at night thinking, oh, do we have enough oxygen? But now I see that through COVID, we have oxygen plants. We have companies, big companies, for example, in Kenya, donating oxygen tanks, you know, and that's amazing. But also on the other hand, COVID also exposed our primary health care and maybe even weakened it, because it made us actually take all the resources and concentrate on one disease. It's okay, yes, but we forgot that there are many others. We forgot care, maternal care. We forgot sexual and reproductive health services. People still needed condoms. People still needed contraceptives. You know, but all our focus now was preventing the pandemic or addressing the pandemic. And then also there are non-communicable diseases. There are people who needed that hospital bed, people who needed that oxygen as their primary providence so that they can maybe tolerate the chemotherapy or tolerate the heart surgery. So as we are moving forward, as much you want to build a strong primary healthcare, it has to be quite resilient, Gigi.
Yes.
Not just for pandemics, but also climate resilient. We've seen what flooding is doing to communities. Right now, I'm seeing right now there's a lot of heat waves all over the world.
Yes.
And these heat waves are bringing up some, what we call burning. And we are seeing a lot of wild bushfires that are destroying communities.
Yeah.
So in my mind, I'm thinking, what's happening in the hospitals? Are they also burning? That pregnant woman, is she getting a place to deliver her baby safely? And then look at, for example, in Malawi, there was flooding the other day.
Yes.
And again, that may have exposed their healthcare. So as much as we're talking about building resilient healthcare systems, we have to look at both the pandemics, upcoming pandemics or future pandemics, but also incorporate climate resilient primary healthcare providence. So that end of the day, we are facing our future with confidence.
Well, indirectly, it had affected me, not directly. Indirectly, because of my friends and relatives, most people were retrenched at work, so there were no jobs. But me, as for direct, my company was good enough to pay us while sitting home, yeah. So to me, it didn't affect me directly.
Okay. We are lacking manpower as far as this country is concerned. This issue of brain drain, that many of the medical personnel who have just graduated will now begin to have this their pass syndrome. They are, each time they finish their education, they prefer moving to abroad than to work for their own country right here in Nigeria.
Nikiona kama mtu ni mgonjwa, hafai kushinda kwa nyumba akisema nitapona tu, anafaa kwenda kuona daktari. Na pia government inafaa kufungua hospitali mingi karibu na pale watu wanaishi.
Just before we come to the end of the show, I want you, Reverend, to perhaps share some examples of countries, whether it's in Africa or outside Africa, where the delivery of primary health care has been successful, is very strong, and they're much closer or have already attained the UHC targets.
Yes, I will begin with my own country, Ghana. I think the Ministry of Health and the Ghana Health Service have come together to promote the community health plan and services. This is a program where healthcare is taken to communities. How? Through volunteers.
Yes.
The community leaders are involved, the chiefs, nurses, ordinary people come together to brainstorm, to plan, and then to execute the services to the people in the district, in the place, far to reach places. And it's all over the country. And Ghana is now in where primary healthcare delivery is concerned. Ghana is hailed as one of the countries where they have been able to put this thing in place.
Absolutely, that's very true. And Dr. Marianne, I know that you like to give example about one of your favorite countries, Rwanda. So I think you can share a little bit about that. I think there have been a lot of countries, or a few countries still, but still commendable nevertheless, that are attaining the Abuja Declaration commitments as well. So maybe you could just shed a light on that.
Yes, of course, my favorite country is Kenya. But
biased, but of course.
I admire Rwanda. So during the pandemic, they even had robots. I traveled to Rwanda during the pandemic for a meeting, and at the airport I was met by a robot. Can you imagine? And this robot was taking my temperature, and it was, just had a message on the screen. And I thought, oh, cool. I also saw the other day they had drones delivering services to far-flung villages, and I thought, wow, this country is really making a lot of progresses. But also, having done a bit more research on Rwanda and what they got it right is probably what Reverend is talking about, making sure that every person can own up to primary health care in terms of they know what they need to do. They have strengthened the community workers, community volunteers who are working together, not just with medics, but other traditional leaders. And so when a message is brought about washing of hands or drinking clean water, that message is heard loud and it's implemented. I know on some certain Saturdays, there's no traffic in Rwanda. I think cars are locked up.
Yes, everybody
And
walks.
They walk and clean up. I think what they call settle. I saw that also. I lived in the Gambia for a while, and the first Saturday of the month, there was no car on the road, and everyone was meant to clean up the area around.
That's true.
And I thought, wow,
yeah.
this
It's actually
amazing.
It's personal responsibility, and I'll just share my own personal experience when I was in Rwanda. You know, I went back home and I was telling people that you can't even litter in Rwanda because you feel extremely bad. You be literally the only person who does that. That's the kind of obligation that the cleanliness in that country puts on you, even as a visitor, as a tourist. And when I was in Rwanda, I had a taxi driver pick me up from the airport, and as he was driving me to the hotel, he stopped midway to pick up a sweet wrapper. I was like, what? That does not happen in my country. And I've actually never seen that happening anywhere, where somebody just stops and picks up litter that, they did not drop, but because, they saw a need and they're taking it up as their responsibility, And again, it goes to what we've been talking about throughout all the episodes, exemplary leadership is very, very...
Leadership and also personal responsibility. That I have all that's around me to make sure that I'm well, my well-being is taken care of, I'm healthy in terms of even that walking up and down on a certain Saturday of the month. And also I've seen that Rwanda, back to Rwanda, they really, the government, they have set apart quite a bit of resources to make sure that both the delivery systems in terms of maternal health is well addressed, sexual and reproductive health is well addressed. Can I tell you something about Rwanda as well? When I was looking at the statistics, for example, for HPV vaccinations, they are one of the top countries, not just in Africa, but in the world, in terms of vaccinating both their boys and girls. And I tell my students, do you know what? In a few years' time, Rwanda would have eliminated cervical cancer. So we need to really up our game in terms of what are we doing? Yes, we have very good hospitals, we have very good equipment.
Absolutely.
But that primary health providence in terms of basic knowledge, preventions, vaccinations, clean water, and many other things will prevent these massive hospitalizations in the future. These non-communicable diseases as well, we can prevent them right at the start if we implement good primary care.
No, that's absolutely true. And I think a key factor here is the issue of financing. One development practitioner once told me, don't tell me what you prioritize, show me your budget and I'll tell you what you prioritize. And Rwanda, South Africa, one of the few countries in Africa that have actually met the Abuja Declaration commitment of committing at least 15% of the national budget to the health sector.
Yes, I think it's a political will. She mentioned about the government of Rwanda. They have identified their priority in terms of what they want to achieve by UHC, Universal Health Care for All. And they have committed themselves to it. I think the importance or the benefit of this platform and Africa Health Check is that when you hear these stories, if any minister, any government leader in any of a country in Africa is hearing these, about Rwanda, about Malawi, and some of these places, that you can do the same because right in front of us, next door, Rwanda, they are there. You would have thought that it would happen in a developed country somewhere, but right in Africa, some people have come together and the leadership have driven the whole nation behind it. I'm enthused by this story about a taxi driver stopping to pick up a trash by the roadside.
Yes.
I want my fellow Ghanaians to hear that. I want my government leaders to hear that.
Absolutely.
I want people in Nigeria to hear this on Africa Health Check. This is what it's all about, that it is achievable.
It's possible.
It's possible.
It's possible.
Thank
That's
you.
the biggest message here for today, Gigi, that it's achievable to have good primary health care for all in Africa. And that just means we need to just, as you said, show me your priority, show me your budget, and I'll show you your priority.
Yes.
By budgeting well, prioritizing very good care for citizenship, strengthening the healthcare systems, education is also key. So there's many pillars that make up primary healthcare, and it starts with you and me.
Yes, and isn't it no shocker though, this is going to be a Rwanda fan-based episode, but isn't it no coincidence that as we're talking about Rwanda, PHC, UHC, and all the progress that the country has made over the last few years, it's also the country that is doing so well in terms of women's representation in leadership position in parliament. I believe last time I checked, they had the highest representation of women in parliament. Right?
Indeed. I think it's just a whole round, a wealthy nation, a healthy nation is a thriving nation.
Yes.
And again, I can imagine also their maternal and women services for their health is also top notch because they also have women on the table. They have the key populations on the table making key decisions. You know, what are women's needs? What are the young girls' needs? What do the adolescents
young
need?
people.
Because I mean, look at the HPV vaccine uptake in Rwanda. But again, not just Rwanda, many other countries in Africa making very good strides. Ghana being one of them. South Africa is making very good strides. The other day I was reading about Ethiopia. Ethiopia has really strengthened their community workers. In South Africa, I was reading about their ward system, WARD, ward in the hospital, where they have a tier of how they approach the patient. There's a doctor, there's a nurse, there's a community worker who then follows up with the patient once they're discharged. How are they settling back at home? Are they thriving well? And that way, they've really strengthened how this patient will recover, the medication that they need. So there's many, many wonderful stories coming out of Africa in terms of primary health care, providence. And I feel we can do much more, learn from one another, and strengthen the system.
So recently, Rwanda hosted the Women Deliver Conference. So I wanted to just wrap this up by taking a slogan from that conference that women deliver a lot more than just babies.
Good one.
Before we wrap up the show today, I want us to highlight our Africa Health Champion for this episode. So let us head over to Ethiopia to highlight Frewini Mebratu, who is our Africa Health Champion for this episode. Let's have a look.
In Ethiopia, Frewini Mebratu transformed from a local hero to an Africa Health Champion. Her journey began as a beacon of hope for girls and women across the country, as she tirelessly distributed reusable menstrual pads to ensure education remained a possibility for hundreds of young minds. When COVID-19 struck, she leveraged her factory, Mariam Seba, known for producing reusable menstrual products, to produce face masks, a symbol of protection in a world gripped by uncertainty. Frewini's compassion and innovation embody the power of one individual to create lasting impact, making her a very honorable addition to our Africa Health Champions.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories that we highlight here. Follow us on Facebook, Twitter, YouTube, LinkedIn, and Instagram. Remember, the handle is @AfricaHealthCheck. Until we meet again, same time, same place, same date. Remember, the future is Africa, the future is today.